Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on one of the important topics and one of the common topics and painful topics to the parents, that is physiological neonatal jaundice. This is the most common jaundice in the newborn. The problem with this disease is normally it is mild, it is transient, it is there for few days and it disappears. What happens in some cases is it will be prolonged, it becomes serious in some of the cases. Out of 60% of the neonates who are born after the term, means after full completion of their months, if they are born, 60% of them will have this jaundice. And if they are premature, if they are born before the completion of the months, 80% of the children will have this problem. The main problem we are going to see in this disease is the kid is small and he has to undergo multiple phototherapies. It is painful to the kids and also painful to the both mother and father. And to measure the blood levels of total bilirubin, they will be pricking the vein. The boy will be crying or the girl will be crying, and this cannot be tolerated by the parents. And also, if this becomes serious and there need to be a blood transfusion is also a dangerous process and also a painful process. All this is done, the baby is not recovering, then what happens is there can be a serious form of this disease that is known as kernicterus. Kernicterus means there will be serious damage to the brain which can lead to hearing impairment, vision impairment, cerebral palsy where the entire body get paralyzed, and also there can be decreased intelligence and lot of cognitive disabilities because of this seriousness of this disease. Unfortunately, in allopathy there are only limited treatments, that is either phototherapy or blood transfusion. Other than that they don't have anything. But coming to homeopathy, homeopathy has the best answer for this. So whether it is in the first stage, second stage or severe stage, homeopathy offers you very good treatment without a single side effect, and also it is very effective. In this disease what happens is the liver of the baby is immature, so there are no medicines in any other system of medicine to improve the liver capacity, but in homeopathy there are specific medicines to improve the liver and to mature the liver. And also there are specific medicines to be given to the kids who are born prematurely. All the complications of the premature birth, including low function of the liver, can be excellently handled by homeopathy. Homeopathy has scope both in preventing the disease, in going into serious complications. And if you are already in the serious complications, you can take the homeopathic treatment so that the duration of phototherapy will be reduced or the frequency of phototherapy reduced. And also you can avoid blood transfusion, and also you can avoid serious damage to the brain. In any cases, it reduces hospitalization or it prevents you from hospitalization or it discharges you quickly from the hospitalization. There are a lot of advantages with homeopathic treatment. We'll completely look into this in this program. What exactly is this physiological neonatal jaundice? Physiological neonatal jaundice is a disease. It occurs in most of the kids. What happens is the liver is immature. The liver is not mature. It cannot synthesize the required enzymes that are responsible for the breakdown of RBC. When the RBC or red blood corpuscles are breakdown in the kid, they has to be eliminated in the body. Major part of this is done by the liver. If the liver is matured, these waste materials which is yellow in color or green in color are not eliminated by the body and they accumulated in the body, and this is known as physiological neonatal jaundice. One more problem we see with this disease is there are a lot of other diseases that can cause jaundice. So not only physiological jaundice, there are other jaundice. There are hundreds of varieties of jaundice, so that can complicate the disease as well. Homeopathy is effective in both physiological jaundice and also any pathological jaundice. Also, homeopathy is very effective.
Fidicus Homeopathy